but I think we need to start off with our panel. Thank you so much for being with us. We're going to start right away with Nudar Chowdhury from the Cooperative, who will talk about health impacts of lead exposure and health department's lead-related responsibilities and examples of successful collaborations. And then at the end, we'll take some Q&A. So Nudar, off to you. Thank you.
Hi, everyone. I'm just going to go ahead and share my screen. So my name is Nudar Chowdhury. I'm the program manager for Lead and Healthy Homes at the Cooperative. I'm also the Southern Regional Childhood Lead Coalition Coordinator. So I know a lot of the folks I see we have done amazing work with, and I'm just going to be talking today about, the focus today is preventing lead exposure in your community. And so I'm going to be talking about a collective impact approach and kind of going over the health effects of lead and the role of health departments as well. Can everybody see my screen okay? Yeah? Okay, awesome. Just to go really briefly into my role. So I'm the program manager for Lead and Healthy Homes at the Cooperative, which is a state licensed maternal and child health consortium, which focus on maternal, fetal, and newborn care throughout the 7 southern counties. Along with my role as the program manager for Lead and Healthy Homes, I also serve as the coordinator for the Southern Regional Lead and Healthy Homes Coalition. So this coalition really exists to bring awareness to and eliminate childhood lead poisoning in South Jersey. If you're from throughout the state, you know there's also a Northern and Central coalition. And so I work in the 7 southern counties, which is Atlantic, Burlington, Camden, Cape May, Cumberland, Gloucester, and Salem. And the coalition is made up of professionals from local health departments, healthcare providers, hospital staff, Medicaid organizations, and other community-based organizations who are really here to, help with this issue of childhood lead poisoning. So we provide professional and consumer education. So we do workshops, webinars, we do trainings for both professionals and consumers, and we have a variety of different resources available to the community. So let's talk a little bit about lead and its impact on childhood health. So for anybody who might be on the call who is not too familiar with lead, I just wanted to go over what lead is. So it's a natural and toxic chemical that can be found in many things. For example, it can be found in old paint from homes built before 1978, and plumbing fixtures and pipes from homes that were built before 1986. It can be found in soil, gasoline, foreign-made products. There's a lot of products that people have in their homes that are from other countries, and there's a lot less regulations in other countries when it comes to lead. So you have kids who might be playing with toys, you might be using certain ingredients, and there might be high levels of lead present in those items. It can also be found in bullets and fishing sinkers, hobbies such as stained glass and candle making, and certain occupations such as construction, engineering, and automotive repairs. And there is no safe amount of lead in a person's body. That being said, there is a national blood reference level that we all follow, which is 3.5 micrograms per deciliter. This is what the CDC recognizes, and officially, as of the last few months, that's what the New Jersey Department of Health also recognizes. So, a lot of us, the work that we do here focuses on pregnant women and children from the ages of 0 to 6. That's kind of our target audience. So pregnant women with the blood lead level of 5 micrograms per deciliter can result in reduced infant growth. So that's one of the big health impacts when it comes to pregnant women. When it comes to children, especially children who are from the ages of 0 to 6, we see a lot of kids who have high levels of lead in their blood exhibit learning disabilities, which can show up as poor grades, low standardized test scores, lower IQ, and sometimes a need for special education services. Another big indication of a high BLL would be behavioral problems. This is one that a lot of parents exhibit, but they might not realize why their child is exhibiting these behaviors, such as ADHD, aggressive behavior, difficulty socializing with their peers, poor decision making, dropping out of school, juvenile delinquency, and incarceration in adulthood. So there's actually a very recent study done on folks who are incarcerated right now, and a large percent of the population had lead poisoning as children that went untreated throughout their life. So we see that, behavioral problems are very indicative of this, but a lot of people might not necessarily tie it to this. It can happen out of nowhere for a lot of parents. Their kids, might behave fine, and then they find themselves in like a new home, and out of nowhere, over time, they see these behavioral changes in their children, and they don't really understand why it's happening. Some other health effects of lead poisoning in children can be permanent brain damage and hearing loss, anemia, kidney damage, coma and convulsions, high blood pressure, and hypertension. And we don't see this a lot, but sometimes in the more extreme cases, we can see it result in death. And when it comes to high levels of lead in the blood system, it can get to a certain level in which your body will start to absorb it into the bones, and there's the possibility of you being repoisoned throughout your lifetime. So really the goal of the work that we're trying to do is make sure that definitely children don't get to that point where the levels are in the 40 or 50 micrograms per deciliter. So some signs and symptoms of lead poisoning. Signs and symptoms of lead poisoning can be easily overlooked in children because they mimic other diseases and other type of illnesses. So some include stomach pain and cramps, aggressive behavior, constipation, sleep problems, headaches, crankiness, loss of appetite, feeling tired most of the time, high blood pressure, numbness or tingling in the arms and legs, memory loss, low iron levels in the blood. So again, these are symptoms that can be associated with a lot of different illnesses. And that's why it's important than ever that, especially if you live in a home that was built before lead was banned, which was in the year of 1978, you'd get your children tested. Because they could be exhibiting all of these behaviors, and you might just chalk it down to them not feeling well, them just being sick, but it could be indicative of a much bigger problem. That being said, the only way to know if your child has a high blood lead level is through a blood test. So in New Jersey, children are required by law to be tested at the age of 1 and 2. If a child has not been tested at the required ages, it is recommended that they be tested before they turn 6, because from the ages of 0 to 6, children are developing, their immune systems are building, and they're way more susceptible to these symptoms than adults would be. And so one way is blood can be drawn either through a vein in the arm, or like a venous draw, we call it, or through a finger stick prick. And currently the national DOH recognizes a blood level of 3.5 micrograms per deciliter or higher to be hazardous to a child's health. So what now? Say you have a child who has a high blood lead level, what do you do? So obviously the first thing is to get them tested. And this is where we see the role of the health departments, especially heightened when it comes to childhood lead poisoning. They play a very key role. A lot of us here, we're just here to really provide that education and outreach so that people are aware of the problem. But the health departments have this huge responsibility to the community in the role that they play. So some of the resources that they offer include free testing. So that's one of their is a great resource available to folks, especially to folks who might be uninsured. The health department support blood testing and reporting. So they identify areas in each county where children are likelier to be exposed to lead. So they do the research. They know which housing stock people are living in that is more susceptible to lead poisoning. And once they identify those, they make it known to the community, and they provide testing in-house for children, especially for children under the ages of 6. They link children to services or families to services. So the health departments ensure that children who are exposed to lead have access to recommended follow-up services, parental education, counseling, and medical intervention. On top of this, they are responsible for identifying hazards in your homes. So the health departments identify lead hazards in the homes and oversee the abatement process. So say you have your home tested, the health department has come in, they will connect you to lead abatement programs throughout the state. Some of the health departments even have funding available for lead abatement. So, a big disparity that we see in the community is that once the issue of lead is identified, a lot of families cannot afford abatement. So they will connect you to services that help with this funding. And there's funding all throughout the state available. In some cases, they can help with abatement up to $18,000 in remediation. So, they play a very key role in making sure that people are able to deal with this problem in an affordable way. And of course, another big role that they play is that they are here to educate the community. So, if you ever want to know more about it, they have specialists on their team who you can talk to, who you can meet with, and they will help you through the steps. If you are living in a home that was built before 1978, or you're worried about lead. And to end it off, I just wanted to talk a little bit about some successful partnerships that we've seen. And I'm lucky to say that we have some amazing partners throughout the southern region and throughout the state. Like Lead Free New Jersey has been an amazing partnership. Especially when it comes to educating the community. They host amazing webinars like the one we're doing today. So we're able to really educate folks. Um, and also, we've been able to really increase lead screenings throughout the state through our sub-grantee contract. So here at my program specifically, we've established some sub-grantee partnerships over the last few fiscal years. So the objective of this is to increase lead screening rates amongst children 0 to 6 in the counties of the sub-grantee by raising awareness in the importance of screening, simplifying the process of obtaining a screening, and hosting lead screening events. And the sub-grantees organize lead screening events in the respective county. And they also do a Rinse the Raccoon curriculum, which has been an amazing resource for the communities to become more aware about lead and just, keeping a healthy home overall. And so some notable partnerships we had is with Virtua Pediatric Mobile Services. So they have 2 pediatric mobile service units that go out into the community multiple times a week and provides testing for children. And they don't just do lead screenings, they do physicals, they do other types of testing. So it's an amazing resource that's available in the Southern County. And not only does Virtua do it, but the Salem County Health Department has actually acquired their own pediatric unit. So that's been an amazing resource in Salem as well. And so how we partner up with them is that they provide the testing and we're there to provide the education, which, has been an amazing way to really get our outreach out there. A lot of the events will be hosted at schools where there's hundreds and hundreds of students, and their parents are present during the physicals, and we're able to really bring awareness to childhood lead poisoning through this way. Another notable partner has been Jefferson Health Services. They do very similar work to Virtua in doing screenings, and again, we're able to be there to provide the education while they do the testing on site. And then I wanted to give another special shout out to another one of our sub-grantees, Green and Healthy Homes Initiatives. I know a few of them are on the call right now, but this has been an amazing partnership. We've really been able to provide both professional and consumer education together throughout the state. And really, bring all the folks who are working in lead to the table to have important conversations, to meet each other face to face, and, continue figuring out ways that we can all work together to better this work and make it more accessible to the communities that we serve. So these are just some few examples of amazing partnerships that we've had that have really benefited all of us and have benefited the communities that we serve. And that is my presentation for today. I just wanted to put my information on the screen in case anybody wanted to reach out to me afterwards. I do have to hop off the webinar in a few minutes to go to another event. But if anybody has any questions, please contact Cassie, or you can contact me directly, and I would be happy to speak to anybody.
Thank you, Nudar.